For many, they might just be like, okay, you're a healthy 30-year-old. EKG doesn't read heart attack. I don't know. Calm down and go home.
Heart disease kills more women every year than all forms of cancer combined. The way we treat women's heart condition is still based on research predominantly done in men.
Like, I felt so alone because at 23, it's very lonely to be in heart failure.
There are unique conditions in women. Research is lacking.
They started me on some anti-anxiety medications, and they were telling me it was not cardiac related. But this time, I'm like, there is something wrong.
Is that you?
Jack and I got married in 2019. We have 2 boys, Nico, who's 4, and Ellis, who's 1.5. Ellis is wanting to do everything that Nico does. Nico is teaching him all the things, good and bad. We always saw a big family.
Ellis, come here.
These are the good old days, and that's something that I think about on stressful days or hard days, just how lucky we are.
I had just gotten off of a call. I started to feel a pain in my back, kind of forward into my chest, up my neck, and into the base of my head.
She really wasn't feeling well. And as soon as I heard her voice, I could tell, you're describing a heart attack.
And I remember thinking, what? Like, are you mistaken?
I think it was so far from the realm of possibility of something that I could be experiencing as a 30-something-year-old young woman with no history of heart disease in my family or heart attacks.
Sometimes there can be an identifiable trigger like pregnancy. Often there are no identifiable triggers.
Their team, I think, was already clued into the symptoms that I was having and kind of tipped off to what it could be.
We were able to move more quickly in diagnosing Isabel. We had a ton of topics to cover right after that hospitalization and after her initial recovery.
We came home with him on Valentine's Day and just be the 4 of us as a family for the first time and have Nico meet his little brother, and he'd been so excited to meet him.
Gentle. Good job, buddy.
And he came running up the stairs, and Ellis was laying in his little DockATot, and he said, "That's my brother, it's Ellis." So it was a very sweet moment. The next day, we settled in to the couch for the morning, and we were watching the Chiefs parade.
There was not a single stressor at all, so I was very surprised when she told me that she felt like she was having symptoms again.
There was no mistaking it, that's exactly what it was. The first thing that came to my mind was, I'm not gonna be able to have more kids.
I'm just looking at this 6-day-old baby thinking, you gotta be with your mom. You gotta be with your mom. And she is in the hospital.
It was just really hard to it was just really hard to think about having to tell Nico and tell Ellis about who their mom was. But thank God that's not the case.
Life is fragile. And I've learned that being an advocate for yourself is very important. Knowing that women get turned away with these symptoms from their doctors or from ERs, and it being chalked up to things like panic attacks or just not feeling well or maybe just high blood pressure.
It's true that before, when patients would come in without an identifiable plaque as being responsible for their heart attack, we would sort of bench diagnoses to say, we haven't been able to identify a plaque as the cause, and we don't know what the cause was. I think the approach to care is so different now. Thanks to Tracy and Marcia's recognition of these needs of advocacy and education in the early stages contributed a lot to that.
Having people that care and that support you is huge.
Why do you think you're a stinker?
Being able to be in the city with your kids and your grandkids, it's a gift. And we get together often. Number one, Chiefs fans, go Chiefs. If we're not at the game, we're having our family together here, we're watching it, enjoying it. Families is life, and life is good.
Dawn loves helping others. She's always been in that field when she's been a nurse. It's in her nature. She's always wanting to help others.
I did a lot of Zoom calling in my position. About 800 people were on the call, physicians, nurses, nurse practitioners, and I start to have chest pain. I'm having a medical emergency and I have to go and click because I knew something wasn't right.
None of the tests that they have, other than showing that there's some irregularities in her heart, they can't really pinpoint what's causing it.
What they do for many women. What I started with is I had an upper GI, then I had a swallow steady. They put me on gastric medications, and they were telling me it was not cardiac related.
They go from health systems to health system, a doctor to a doctor, one test to a next test. But you see the health system and what we've created so far tries to answer one question, which is, does this patient have cholesterol buildup in the arteries or not, right? But the patient is asking, what is my chest pain?
We're having to go back to the hospital, and then all of a sudden we're getting calls that she's like having to go back again, and then it was again, and then it was just felt like it was just continual.
We knew there was something more going on.
And there was no way I was going to give up. Sometimes I always think God takes care of you and puts you in places where you're supposed to be, but it was literally 1.1 miles from St. Luke's North. Took all my vitals, gave them my history, and they said, we're going to admit you. We agree there's something cardiac going on. And I think probably the first affirmation I can still remember, Dr. Iyer, he put his hand on my hand when I was laying in the bed, and he said, we're gonna figure this out.
We saw that there was no blockages, but my colleague knew that there was other things, other mechanisms that could potentially go wrong. And we're able to sort of do those comprehensive analysis of the arteries and figure out, yep, this is the exact mechanism that's causing your symptoms, Dawn.
It was like a big weight off of her shoulders.
It was an emotional time because we did finally get that answer that she had fought for a long time to get.
Dr. Jacob then talks to me, and I remember it being in the room, and he shows the pictures, and he says, we have a diagnosis. You have non-obstructive coronary artery disease.
Validating one symptom and associating that with the mechanism, that is profound. That is profound.
It's not just validating the diagnosis, but being able to explain it and have the awareness that it exists. And then it starts to set in that there's no cure. There's no cure for what I have. And it's terminal. And then you look at research and how little there's been done. It's only been able to diagnose for like the last 3 years. Why now? Why me? But as I got through that, going to Dr. Jacob and Dr. Grodzinski that really helped and listened to me, then I got to acceptance. And then I got to the freedom. And I got to the freedom that it is my disease and my story.
After the treatment, she was far more active. And she was happier. Simply put, happier,
I live every day to the fullest. I wake up every morning and I'm blessed that the sun came up and it's going to be a blessed day. And every night before I go to bed, I pray for tomorrow. I know what it's like to feel like you have no hope. But then I know what it's like to have hope given back to you. I owe my life to them. My family is so grateful for them.
Yes, well done. What was the best part of your day?
Getting home to see you.
Aww.
Dan and I actually met here. It's kind of where our love story started. So I went to high school here locally, and Dan was attending college.
We'd been dating for a couple years. I was kind of on the middle tail end of a 15-month deployment to Iraq.
I was working on my master's degree. I was working retail at the time. I was just trying to stay super busy, kind of keep my mind off that deployment. But I was having these episodes of rapid heart rate while at rest.
And she emailed me and said, hey, this is what's going on. I'm going to go to the hospital. Might not be anything. Just want to let you know. Turns out it was something pretty significant.
You know, a couple of weeks I was told that I was in heart failure, and I was only 23 years old. Dan had already proposed to me, and so I went back to him and I said, the girl you proposed to could give you a family. I want to make sure that you still want me.
And she's obviously the right person for me. Kids were always a big thing both of us wanted, but I knew I didn't want to do it without her. And shortly after we got married, we moved to Kansas, and that's where we started first working with St. Luke's.
And it turned out to be one of the best decisions I ever made.
I met Jenna close to 20 years ago when she had developed congestive heart failure. With medications, her heart improved. She did well enough that we, after long discussions, decided that it was okay for her to get pregnant, recognizing that there may be some complications. Thankfully, she had a healthy young little girl, Marianne.
Going from a place where we never thought that was a possibility for us to holding my child was just earth-shattering in the best possible way.
Hi, big girl. Here, will you take?
A couple years later, things started to kind of decline, and they started declining faster and faster.
She got back into congestive heart failure and started to struggle again, leading us to evaluate her and put her on the heart transplant list.
This is it. Like, you will leave here with a heart, or you won't get one.
And they were looking at a bunch of different things that we could try and do. We had talks about MitraClip valves.
Having an LVAD put in.
She had the PICC line. She had had that the entire time she was on the transplant list.
I was 5'2" and barely holding on to 100 pounds. I was just so incredibly small that I think Dr. Migalski was genuinely worried about where the LVAD would go inside my body to pump my heart.
When she was in the hospital, things kept getting worse to the point where they wanted to put in the balloon pump.
But where it should have stopped right around my sternum, it was actually coming all the way down to my belly. And so after a few days, that balloon pump actually failed and it was removed.
We had a kind of a mad scramble to try to find another one that was available to her and to us, so her other organs didn't fail.
St. Luke's then couriered a pediatric balloon pump from Chicago.
There were less than probably 10 or 15% of women were even tested with these devices.
I was frustrated at the fact that they don't have devices readily available that are designed to fit petite women or women in general. By not having my balloon pump, I've decreased the level of urgency in my eligibility.
And depending upon how long people wait on the list, it can be weeks, it could be months.
You really try hard not to think about the option that you won't get a heart.
I want my then to have a new heart soon, and I want her to come home soon. And
I remember telling Dan that there's a camp in Boston for girls who don't have moms anymore, and make sure that Marianne gets to go to camp with girls that are in her situation. And that was the hardest part, just thinking about what it would be like for my kids not to have a mom. I was number 689, and now that they're beyond 1,000, like, you just know you're going to be okay.
The cardiac team at St. Luke's is fantastic and amazing. All the doctors know my kids by name.
St. Luke's knows what they're doing. They exude confidence because they have it. I'm gonna be 9 years out of my transplant in February.
Life now is fantastic. I've got a great family, 2 kids that are happy, healthy. Every day we truly count as a blessing.
I feel very fortunate to have had my transplant and be able to see my kids grow up as far as I have. And I have full faith that I'm going to see them graduate and I'm going to see them get married. And all of that comes down to the research and the care that I've received at St. Luke's. Being a woman and being at St. Luke's is amazing because I know that there is someone fighting for me as a woman. There is literally a team fighting for women's heart health.
This past 30 years has been an amazing journey where we have raised awareness, educated, we have been fierce advocates on Capitol Hill, and we're not finished yet.
We need more awareness, we need more education, we need more research.
We need national partners, we need our community partners.
We know we will continue to grow. There's lots of work to do.
We need our patients to advocate as well.
We can do our part in raising that awareness. I think that goes so far.
What brings me so much hope is knowing how much research we're doing, because I know that the longer I last with this heart, I may never need another transplant.
While the research can fully help me, I don't know, but I sure can help my daughters if they would have it, and my granddaughter, and all of those to come. And I want it to be because of St. Luke's. Thank you for allowing me to share my story and for making a difference, not just for me, but for others.
From prevention to treatment to diving into the depths of research and making it a lifelong commitment. We've done this, we've been here before. Nothing's going to slow us down.